pain that doesn't come from the shoulder. This little discussion was inspired by a recent case we saw of a lady who had what looked like impingement pain in the shoulder. Impingement is pain that comes from a tendonitis in the shoulder and usually presents when people bring their arm into certain positions, reaching overhead, reaching out to the side. And it occurs because a tendon that's swollen or irritated gets caught or pinched in certain positions. Now, there's a lot of different causes of impingements on it. I won't go into the discussion there, but often when people present with those kind of reports in their history of catching, pinching pain when the shoulder moves, the natural assumption is that the problem is in the shoulder. This particular lady had had 6 months of rehabilitation of corrective exercises for rotator cuff, which were all pretty standard, but hadn't really seen a significant change in her symptoms. So from my point of view, that was the first clue that maybe there was something else going on here. So one of the features we see in clinic all the time is that people who have persistent shoulder pain invariably will develop secondary issues in the neck. Sometimes they're aware of pain in the neck. Other times it's just a subclinical finding in that you examine the tissues around the neck, in the joints, in the muscles, and into the upper back, and you find areas of restriction of movement or sensitivity, and people aren't aware that there's an issue there. So for a long-standing issue with the shoulder, very often you'll get coexisting problems in the neck. The explanation for that is that if the normal mechanics of how the shoulder move is compromised, people end up using the shoulder essentially by dragging the arm, which puts more pressure through the neck and upper back. So that appears to be the connection between the two. But back to the story at hand. This particular lady was presenting with catching, pinching pain and symptoms that hadn't resolved with treating the shoulder. And when we examined the base of the neck and the upper back, we found two areas, the first and second ribs and the associated joints, which are the thoracic joints, T1 and T2, where the joints were particularly stiff and sensitive. And that's important because pain from those areas can be referred out into the shoulder. So that's, if you like, a referral zone. I'm sure you've all heard of the idea of referred pain. And referred pain is when pain comes from one area but is felt in another. So it can give people a false impression of where symptoms are being generated. But the second thing about the ribs and having proper mechanics is that when we move our arm through different positions, the joints in the upper back and the ribs all need to be able to move to facilitate that kind of motion. So if the joints are restricted or painful, then that will often mimic a problem in the shoulder, because it's shoulder movement that brings the symptoms on. So you can see how it can become slightly confused unless one systematically examines all the areas involved. So usually there's a defined history, but sometimes not. It often will be a consequence down the track of a fall, typically a fall on an outstretched arm, where any of the structures along the line of the arm are vulnerable to tissue damage. So that's one mechanism. Whiplash is a very common one, where the jolting motion of the head reefs or pulls the attachments of the muscles onto the upper ribs. And some people are a bit surprised, but the first rib is a little small semicircular structure tucked right in behind your collarbone. So because the shape of the thorax goes up as an apex, the very top of the rib cage are two little small ribs on either side, and they get progressively bigger as we go down. So people are often surprised to find ribs located that far up, but they're important structures from the point of view that there are sensitive tissues close to them, and they are involved in the mechanics of the arm. So they do cause issues. And in this particular case, this was the cause of shoulder pain that wasn't really originating in the shoulder joint. So a timely reminder there. I just thought I'd share that information of a situation where all isn't as it seems, and the alert clinician needs to be tuned in to recognize when some features aren't fitting. The clue for me at that time was that proper systematic treatment of the shoulder wasn't really producing the expected results. the case in question wasn't of an age to have degenerative changes or rotator cuff tears, which might have indicated other kind of pathology. So that then allowed me to explore in different directions, and in this case we got to the crux of the issue by identifying other tissues. So just one to be aware of, not that common clinically. We may only see half a dozen cases of that a year, but very common to have combined issues in the neck, upper back, and in the shoulder. And to get a satisfactory result, you really need to address all of those issues simultaneously. So yeah, just a little clinical story there I thought I'd share with you. Hope you found it interesting. I'll see you again on another video. Bye for now.